Today's episode is graphic in nature. Do not attempt this at home. Now, we all want to look better, right? But how far would you go to improve or hold on to your looks? Stats say 25% of women in this country would like to have plastic surgery. Thanks to the internet, a growing number of them are doing it themselves with tools and products like these. Thread, needle, cuticle scissors, glue. Wow. So think about it. Would you ever stick a needle just right into your face on your own or under your eyelid? Well, she's shaking her head vigorously because that is what my next guest does to stay young. Tamara does her own Botox and doesn't plan on stopping despite the risks. Take a look.
Hi, my name's Tamara Leslie. I'm going to do Botox on my face. I'm 62 years old and I want to look pretty for my husband, so I don't want to have any of those crow's feet. All right, we're ready to start. I'm going to start injecting right here in my eyebrow. Now, I have a little bit of line right here, a little wrinkle right there between my eyes. I have a line across my forehead here. We're ready to do above my eyebrow. I got a deep smile line and go into the wrinkles. Let's go get down to the nitty-gritty. We're going to work on my lips right here so that they pop out a little bit. Right at the line. Now, I will watch this over the next couple of days. I have a little bit left that I can keep and see if I missed any place, and if I did, then I can go back and touch up. Okay, now I'm ready to go.
And we've got Tamara here with us. Please welcome Tamara. So, Tamara, can you understand, people look at that, they get a little, well, first of all, they get queasy. Putting needles in your own face is a little bit difficult to even watch. And secondly, they get scared.
They shouldn't be scared because it's a diabetic needle, and I also use numbing cream before.
Why do you insist on doing it on yourself?
I have had it done by my own plastic surgeon 3 or 4 times, but he charges $500 for a few shots, which is ridiculous when I can buy it for $30. And I'm speaking on behalf of thousands of women in the United States that do it themselves, and we're all on the internet. We connect with each other. We buy from our suppliers.
I have to tell you, it's sort of stunning / confusing. I mean, I understand the economics of it, but it sounds so dangerous. What motivates you to do so much plastic surgery and to the point where you have to do it on yourself?
Well, I'm 62 years old.
You look fantastic.
Because of the Botox.
Your husband, Richard, is here in the audience, right? Richard,
yes.
Hey, does she need to do all this stuff?
Yeah, it's for her. She wants to do it, and I think it looks better with her.
You like her to do it?
I like the overall
Are you
looks.
younger than she is?
Yes.
58. He's 8 years old.
8 years younger.
Than me.
Yes.
But I don't think you have to worry about him. You're not going anywhere, right?
No.
Yeah, okay.
He
Well,
won't leave me.
I don't think so. And so
He is so sexual. He has to have sex 5 nights a week. I have to keep him happy.
So this is awesome, huh?
He's a Scorpio.
Scorpio. Scorpios.
They love sex.
Evidently. This Scorpio certainly does. He's busy stinging 5 nights a week, evidently. But
so I oblige him with the sex and also with the beauty.
That's on one level, it's great. It really is, and I'm so happy for you guys that you have a vibrant sex life, and he thinks you're so beautiful, which you are. But it's concerning that you're going to these lengths to maintain what you think you need, that I don't think he thinks you need, in order to maintain this.
Yes, he does. Yes, he does. All
right.
He likes me without wrinkles.
All right. I'm not going to argue with you. I'm going to bring a plastic surgeon out here who's an expert in this, who can give us some real advice about what the risks are of all this and what you should be doing when we come back from the break.
Okay.
Welcome back. I'm bringing in a life changer, Dr. Kevin Brenner. He's a board-certified plastic and reconstructive surgeon in Beverly Hills. Dr. Brenner, thanks for joining us.
Thanks for having me.
All right. What do you think about what she is doing to herself?
So, this is crazy. I mean, honestly, you're really running severe risks here of seriously harming yourself, injecting yourself with Botox or actually with anything. you can really, really harm yourself. You can go blind if you inject in the wrong place. You can cause your eyelid to pull down if you inject the wrong dose, or you inject your lower eyelid. You can cause your brow to drop down so that you can't open your eye. Or you can even have the Botox leach into your upper eyelid muscle so that you really can't open your eyelid at all.
And are there ever any arterial injections or venous injections that cause really severe systemic complications?
Well, there shouldn't be with Botox. But if you don't know what you're doing and you inject in the wrong place, there is an artery right below your eye, on the inside of your eye, that if you inject it, it goes right to your retina. And people have gone blind from embolisms, where the drug actually goes into the artery right to your retina.
Here's the one question I have, is that you and I get to see all this, the incredible range of medical and surgical complications that occur. The public and the individuals never get to see it. So to them, they get this cavalier attitude about surgery generally and about injectables especially. Obviously, I don't know that I need to articulate this to my viewers, but don't do this alone. Don't do this on yourself. Do not do this, number one. And number two, when doctors have a board certification in whatever field, it gives you the assurance of a particular level of expertise that they are held to. And in plastic surgery, you want board certification in plastic surgery. I'd like to thank all my guests today, especially Dr. Michael Mamoun and Dr. Kevin Brenner.